So here we are back with the anti-epileptic drugs. Let's talk for a minute about the adverse effects. They do vary by the drug, and the adverse effects often cause the need for us to change the medication. Now remember, these are not stopped abruptly, and of course the provider will make a determination on how that change is best to be made. All of these carry a black box warning as of 2008. What happened in 2008, the FDA analyzed some reports from clinical studies that involved patients taking the anti-epileptic drugs. They were taking them for epilepsy, bipolar disorder, psychoses, migraines, and neuropathic pain. Those were just some of the disorders. And so then they looked at these, they found that because these were conditions that were being successfully treated with these anti-epileptic medications, they, although were originally designed to help people who have epilepsy, they started to see that with this extension of use beyond epilepsy, there was some indeed side effects. And when they looked into this in more depth, what they found is that these drugs can cause suicidal thoughts and changes of behavior. So they issued a warning to providers to be sure that they're carefully balancing the need for the anti-epileptic medication against the risk for suicidal thoughts or suicidality among patients that are taking these drugs. One of the key pieces is that we need to educate the patients and the caregivers to pay very close attention to changes in mood and not to make changes in the anti-epileptic drug regimen without consulting their healthcare provider. Now, additional drawbacks to these drugs. Their drug interactions are pretty significant. They're numerous. Many of the anti-epileptic drugs interact with each other. Some induce hepatic metabolism that results in a reduction of the effects of other drugs, and they can actually interfere with birth control. So what we found is in a study in 2013 of mothers who took the anti-epileptic drugs was that while they were pregnant, was that the children were not able to interact socially compared to other children. Their language skills, their motor skills, and some developed autistic traits. So those were present. And the study showed that it compounded the fact that what we've known about the anti-epileptic drugs for many years is that women who take oral contraceptives and anti-epileptic or anti-seizure drugs together are at risk for pregnancy. This is relatively well known in healthcare, and that while the anti-seizure drugs, these anti-epileptic drugs do have their advantages, this is one of their disadvantages, is that you can have pregnancy. We also have interactions like with carbamazepine, that's also known as Tegretol, that we want to avoid grapefruit. It can cause problems with the liver, and it also can cause problems with the absorption and the metabolism of that drug. So it's a pretty long list that we have of these drugs. We know as we go through that we'll look at these, and as you go through your mind map, you'll study some of these in more detail. When we look at the barbiturates, Phenobarbital and Primidone or Mysoline, we can see that the most common adverse effect of these is sedation. The Primidone is metabolized in the liver to phenobarbital. The therapeutic effects occur with serum drug levels of 10 to 40 micrograms per milliliter. Now, phenobarbital is a long-acting barbiturate, and so we've used it it's been around a long time for a variety of seizures. And it's also used for insomnia, but not so often We do have old practitioners sometimes, or older trained practitioners sometimes, who will try to use it for pain relief, but it really should not be used for pain relief because it could actually increase a patient's sensitivity to pain. It acts biochemically in the brain by enhancing the action of GABA, the neurotransmitter GABA. And so that's how it works. It is a Schedule 4 drug that can cause dependence, and contraindications are known drug allergy, porphyria, liver, kidney impairment, and respiratory illness. Adverse effects are usually cardiovascular, central nervous system, GI, and dermatologic reactions. Because it acts with many other drugs, you need to be very careful with it. It should also not ever be taken with alcohol or any other CNS depressants. These substances actually potentiate the action of the barbiturates and increase life-threatening respiratory depression or cardiac arrest. So we have to be very good with our education for patients with this class of medications. Now, the hydantoins, or Phenytoin, also known as Dilantin, has been used as a first-line drug for many years, and it is the prototypical drug that we think of within this group of, or this classification of drugs. They work to dampen the CNS activity by delaying the influx of the sodium ions across the neural membranes. And sodium movement is the major factor that determines whether a neuron is actually going to undergo an action potential. So when we look at these drugs, we see that this movement of sodium occurs, and if the sodium channel guides the movement of the sodium ions into the cell, and then we block that, it's temporarily inactivated, so the neuronal activity is suppressed. When we look at the adverse effects of this drug, gingival hyperplasia is significant, acne, hirsutism, Dilantin facies, and osteoporosis. So the oldest and the most commonly prescribed is Dilantin, or Phenytoin. It was actually approved back in the 1930s. So it's a broad spectrum hydantoin drug. It's useful in the treatment of all kinds of epilepsy except for absence seizures. But it does have a pretty narrow window of therapeutic dose and toxic dose, so they have to be carefully monitored. Some of the Phenytoin-related drugs are used less frequently, and most of them share mechanisms similar. These drugs are highly protein-bound. We will sometimes see carbamazepine that has been used. It actually is approved and used for the treatment of trigeminal neuralgia, which is a very painful condition of the nerve on the facial nerve. It's also used off-label for ADHD, schizophrenia, borderline personality disorder, and PTSD. Some of the newer approved anti-epileptic medications show promise for a treatment of these disorders as well. One of the things to keep in mind for later when you become an RN, or if you are working with an RN, and remember, we want to always be aware that intravenous administration occurs with these drugs. These are not first-line drugs for status epilepticus, but what you'll see is that the patient is given a benzodiazepine, and then we may give the intravenous Dilantin or Phenytoin to then keep the patient or get the patient to a therapeutic level. But these Phenytoins are very irritating to the veins, so they are given slow IV push directly into a large vein through a large gauge venous catheter. It's diluted in normal saline for IV infusion, and we always want to use a filter and follow that with a saline flush. The phosphophentoin, Cerebex, is an injectable prodrug of Phenytoin, and it is a water-soluble Phenytoin derivative. So it can be given intramuscularly or intravenously by IV push or continuous infusion without causing burning on injection that's associated with the Phenytoin. It does have adverse effects, just like any of the other drugs that we are administering, but this is only given IV, and it is for the control of status epilepticus. It is short-term substitute for our oral Phenytoin. Our Phenytoins, whether it's this one or the Dilantin, should be used in caution when we have herbal supplements, especially herbal laxatives, buckthorn, cascara sagrada, or senna, like Sennacat, because it can increase the potassium loss. With our Iminostilbenes, this is our carbamazepine or Tegretol. This is the second most commonly prescribed anti-epileptic drug in the United States after the Phenytoins. Now, when we have this drug in particular, we'll see it prescribed for tonic-clonic and complex partial seizures, but earlier, remember I said that it's useful in trigeminal neuralgia, and that causes intense pain along the jaw. It's also used for bipolar disorder, PTSD, ADHD, borderline personality disorder, but it can cause Stevens-Johnson syndrome. That's a very severe rash that can have celesting of tissue. Can also cause blood disorders, liver disease, and reduced bone health. So it has many drug interactions, and we want to be sure that we monitor for those adverse reactions and drug interactions. With our oxcarbazepine, or trileptal, this is a chemical analog of carbamazepine. Its precise mechanism of action has actually not been fully identified. We see this given for partial seizures and secondarily generalized seizures. Adverse reactions of this drug include headache, dizziness, and nausea. It can cause serious skin and organ hypersensitivity reactions in some patients. Our ethosuximide, or Zerontin, is used in the treatment of uncomplicated absence seizures. This medication is not effective for secondary generalized tonic-clonic seizures. Now, we will see it used in myoclonic and akinetic epilepsy. It can cause GI effects like nausea, anorexia, abdominal pain. It sometimes causes gum overgrowth or that gingival hyperplasia, blood disorder. It can also cause the rash or Stevens-Johnson syndrome and central nervous system effects as well as behavioral changes. So it has many interactions with the hepatic enzyme-inducing drugs and will actually increase Phenytoin serum levels if it's given with those. When we have it given with valproic acid, then these levels, those Zerontin levels, will fluctuate. They sometimes increase and they sometimes decrease. So it can, one of the other big adverse effects of this drug is that it has the potential to impair the mental and physical abilities. So psychosis or extreme mood swings, including depression with suicidal intent, can occur. So we have to be sure that we are cautioning the patient and watching and having the caregivers watch for changes in behavior. Here's our list of miscellaneous drugs that you'll see ordered for seizure disorders. With our gabapentin, this is a chemical analog of GABA, a neurotransmitter that inhibits the brain activity. It's believed to work by increasing the synthesis and synaptic accumulation of GABA between the neurons, and so it is used in the treatment of partial seizures. We're seeing this more often used in the treatment of the neuropathies. Contraindications for gabapentin include a known drug allergy and adverse effects. We've also recently discovered that gabapentin is a drug of abuse, so I anticipate that that will change its classification in the future. Now, it looks like we're going to need to go to yet one more audio lecture, and then perhaps we can wrap it up. See you in a little bit.